myself Aniket Patil. I am Group 4 students of Ocean International Medical University, and this is my presentation on the subject pharmacology, and my topic is the drug omeprazole. So first of all, omeprazole is a drug which is sold in market by the brand names Losec, Losec Mumps and Procalm. These are the three names by which anyone can buy the drug from the local market. So what are the uses of omeprazole? First of all, omeprazole is a drug which is used to reduce acidity in your stomach. It is an anti-acidic drug. It's widely used to treat heartburn. Heartburn is something in which our acid from our stomach goes again back to the esophagus and the tube which carries our food. It also used to prevent indigestion. It also used to prevent stomach ulcers. So what are stomach ulcers? Stomach ulcers are mainly known as the gastric ulcer, which are painful, sore in the stomach lining, and indigestion is a pain or discomfort in your upper abdomen or burning pain behind the breastbone, which is known as heartburn. So it is used to prevent these kind of problems in our body. Omeprazole is a type of medicine. Omeprazole is a type of medicine called a proton pump inhibitor. It inhibits the proton pump in our body. Proton pump are enzymes in the lining of your stomach that help to make acid to digest food. Proton pump is something that proton pumps are the enzyme in the lining of our stomach which helps and make the acid to help in digesting the food. Omeprazole prevents proton pumps working properly, which reduces the amount of acid in the stomach. It inhibits the enzymes which produce acid so as to reduce the amount of acid in our stomach. Hence, by decreasing the amount of acid in our stomach, decreasing acidity. Sometimes omeprazole is taken for a rare condition which is known as Zollinger-Ellison syndrome, which is a tumor of the pancreas or gut. Omeprazole comes in three types of capsules, tablets, or in the form of liquid, which we can directly swallow. All types of omeprazole are available on prescription. You can buy 20 mg tablets from pharmacies and supermarkets by a doctor's prescription. Some facts about omeprazole. Omeprazole starts working within 2 to 3 days, but it may take up to 4 weeks for it to work fully. As the acid increases in our stomach, it causes many problems of acidity. So omeprazole is the one drug which helps in reducing the acidity of our stomach. It works within 2 to 3 days, or it can take up to 4 weeks to work properly fully, as you get fully cured about 4 weeks after you take the drug. Usually omeprazole is taken once a day in the morning for Zollinger-Ellison syndrome, which is the cancer of pancreas or the gut. For Zollinger-Ellison syndromes, one can take it twice a day, otherwise it is taken once a day. Some side effects of omeprazole are headache, diarrhea, and stomach pain. These tend to be mild and go away when you stop taking the medicine. These are temporary side effects. As you stop taking the medicine, they will go away. Omeprazole should not be taken for longer than 2 weeks without checking with a doctor. Sometimes it happens when we have acidity. We usually don't go to doctors. We directly go to the pharmacies, the medical stores, and we asked for the medicine, such as if one knows, he will ask directly omeprazole or otherwise he will tell that I have acidity problem. So the pharmacist provides you medicine. So if you are not connected with the doctor, you are not prescribed a doctor, and you are directly taking omeprazole, so you should not take it more than 2 weeks. As you know, alcohol is acidic. Alcohol can make your stomach produce more acid than normal. This irritates the stomach lining and can make your symptom worse. It's best to avoid alcohol if possible when you are taking omeprazole. This is all about omeprazole. Summarizing, omeprazole is a drug which is mainly used to decrease acid in our stomach, which further prevents us from indigestion, heartburn, acid reflux, and stomach ulcers. It's a proton pump inhibitor. Proton pumps are the enzyme which used to produce acid in our stomach that helps to digest food. It inhibits the proton pump as to inhibiting the enzyme producing acid. That's why reducing the amount of acid in the stomach. Zollinger-Ellison syndrome, which is the rare case tumor of the pancreas or gut. In this case, you can take omeprazole twice a day, otherwise it's taken once a day in the morning. Some side effects are headaches, diarrhea, and stomach pain, which are not that mild. When you stop taking medicine, it will go away. And it's best to avoid alcohol while taking omeprazole, as alcohol make your stomach produce more acid, so it should be avoided while taking omeprazole. That's all about it. Thank you.
Hello everyone, my name is Pratik Zado from Group 4A and my topic is aceclofenac plus paracetamol tablet. Today we are going to see its uses, benefits and side effects. As aceclofenac plus paracetamol tablets belong to the class of non-steroidal anti-inflammatory drugs, also known as the painkillers. Its uses is in osteoarthritis, rheumatoid arthritis, sprain, joint pain, muscle pain, fever, body pain, and headache. Now we are going to see its uses as aceclofenac plus paracetamol tablet, mainly used in the pains. So aceclofenac plus paracetamol tablet is taken by the doctors because it is the medicine given in many problems. Like this tablet is given by looking person's age, gender, and past health problems. If there are any serious side effects on your body, then you should stop taking it and take it after asking a doctor. Apart from this, the effect of aceclofenac plus paracetamol tablet is less for the pregnant women, and also its effect on the woman who breastfeed is less. Do not take aceclofenac plus paracetamol tablet if you already have allergies, heart failures, and diseases such as ulcers, and stomach ulcers. Also, taking aceclofenac plus paracetamol tablet with food does not harm your health, but consumption of alcohol with aceclofenac plus paracetamol tablet harms your health. Never take aceclofenac plus paracetamol tablet while you are driving. So now we are going to see its side effects. As many drugs have its side effects, it also have its side effects like indigestion, seriousness, ever irritation, stomach pain, diarrhea, vomiting, dizziness, red spot, itching or burning, shortness of breath, liver damage, loss of appetite, consumption of moderate, and jaundice medium. Thank you. That's it for today's topic.
Hello, myself Sheikh Mohammed Saif from Group 4A. Today I am going to talk about the drug called as lignocaine, also known as lidocaine. It is a derivative of tertiary amine xylidine. It is mostly preferable choice as a local anesthetic agent. As it has rapid onset of action, widespread with a super safety as compared to older anesthetic agents, often combined with epinephrine to reduce the vasodilation effects. Let's talk about its mechanism of action. It acts on the sodium ionized channels present in the internal surface of nerve cell membrane. It locks them in an open state and prevents the nerve cell depolarization. It is a weak base with an pK value of 7.7. It has more rapid onset of action as compared to older anesthetic with high pK value. In case of inflammation, its efficiency decreases. It may be due to acidosis that decrease the unpolarized ion lignocaine molecules faster decrease its concentration. In cardiac myocardium, lignocaine slowly rise the cardiac action and potential duration of the zero phase. It has 65% less lipid solubility than as compared to other anesthetic agents. Now let's talk about drug administration. It is administered through various routes. First of all, talk about subcutaneously, which is having 0.05 to 0.1%, which is used in a large volume. It is given around the wound site for or also in a small syringe that is to be localized. What we can see during given these drugs, there will be slightly swelling and firmness at that site. Now at the dilate concentration of 1 to 2%, the regional nerve blocks, including epidermal anesthetics, and also given as antiarrhythmic use. 4% of the topical anesthetic is used orally, that is given through mouth in form of sprays. Mouth